Before the worlds began, you were always there. You are Alpha and Omega, beginning and the end. Hello and welcome to the LivingWell broadcast. My name is Dr. Levonne-Samon. I'm a primary care physician and I'm also board certified in internal medicine. My goal with the broadcast is to provide a way for you to send in questions that you may have regarding your medical care. It's not easy sometimes to get the answers that you need. Sometimes we're not even sure what's the right question to ask. So I'm hoping that this broadcast will help give you information that's helpful, that will help guide you along the journey towards better health. In 3 John verse 2, it says, "Dear friend, I hope that all is well with you, and that you are as healthy in body as you are strong in spirit." God wants us to be healthy in our bodies, our soul, and our spirit. And my goal is to guide you by giving some answers to questions that you may have so that you can make a better decision about your health. There's nothing like getting a good understanding of what's going on. So send in your questions and I'll do my best to answer them. So welcome and let's get into today's broadcast. Hello again, Living Well family. It's so good to be with you today. I'm so glad that you joined us. We have another exciting topic today. Last month it was Heart Month, and we gave some tips on things that we can do to keep our hearts healthy. And for those of you who were with us during that broadcast, we talked about things like exercise, diet, rest, stress reduction, and all of those good things. I hope that you were able to implement some of those things and put them into practice. I know that I did. I started doing some things that I had been putting aside, waiting for the weather to warm up. And I decided, there are some things that I can do indoors to keep myself physically active. And so it motivated me, and I hope that it motivated you. You can send in your testimonials and let me know how you're living well since we've heard the information that was presented last broadcast. So today we are going to talk about high blood pressure or hypertension. But before I do that, my foundation is always from God's word. And I wanted to remind us of what he says about us in Psalm 139, verse 14. You're probably very familiar with it, but it says, "We are fearfully and wonderfully made." And fearfully to me means what an awesome work he has done. Those of us who are in medicine and in science, it helps us even appreciate God more. It doesn't make me an atheist. It makes me appreciate the awesomeness and the wonder of God, the way that he intricately designed us, how we are unique. As you've heard many times, even identical twins have different fingerprints, and that's how awesome our God is. And so with these differences that he has made, it's always best to seek him for guidance as to how to take care of the bodies that he has blessed us in. The spirit that are housed in our bodies that God has put in there, we want to make sure that we not only take care of our spirit, but we take care of our natural man as well. And we also want to keep in mind that because we are unique, what may work for one person may not work for another. And it's best to get your advice from trusted resources. It's hard nowadays as a physician to teach people how to take care of themselves because we are in the information age, and so many people are, of course, accessing information online, and that's not a bad thing, but it is not a good thing when your only source is the online information without having the background knowledge to really understand where this information is coming from and how to apply it to you personally. I've had patients who they've already come in with their mind already made up as to what the treatment should be because they've already diagnosed themselves also. So sometimes they are treating the doctor kind of as a reference. I've already done my research, I already know what's wrong with me, and this is what I want you to prescribe for me. And so it's quite a different day from what it used to be. And in a good sense, information is out there and people are accessing it, and it can lead to better health. And it does lead to better health if used correctly. But there are some who have taken the information without understanding it and made bad choices for themselves. I kind of compare it to me reading a manual on how to fly an airplane and then deciding that I know how to do it based on what I've read. That's not safe at all. And I'm not downplaying anyone's wisdom. Thank God, God has given us wisdom and skill and knowledge, and we're able to read. And but reading does not always give you understanding if you don't have all the tools necessary to interpret what's being said. So bring your information to your doctor that you've read, but also be willing to receive a better understanding of what you have read and how you can apply it to make your life better. So, as I said today, we're talking about high blood pressure. First, let's start out defining what is high blood pressure. It is a reading that is above the normal range. And in general, the normal range for most people should be under 139 for the top number and under 90 for the bottom number. So I should say 139 or below for the top number and 89 or below for the bottom number. And then there is a range where it would be too low, which would be anything below 90 for the top number and below 60 for the bottom number. Now, as I started out with the broadcast saying that everybody is different. So, the range for a 25-year-old may not be the same for someone who is 85 years old. And again, you should consult with your doctor as to what is the best blood pressure range for you. Now, how do we get those numbers? As you know, when you go to your doctor's office, they put a cuff around your arm and the cuff tightens. And as your heart is beating, it pumps out blood and then it relaxes so that blood flows back into the heart. So when the blood is pumping out from the heart, the pressure that it flows from the heart is measured as the top number, and that's called the systolic blood pressure. And when the heart relaxes so that the blood can return to the heart, the pressure that flow is measured is called the diastolic pressure. That's the bottom number. And so these numbers are not just something that were randomly picked out of the air. Over years, they have found that there are risks when the numbers are too high. So if the numbers are persistently above a certain range, it may put you at higher risk of heart attacks and strokes. And so um, there are reasonings behind setting those parameters for what a normal blood pressure should be. And then there are things that need to be done to try to keep that blood pressure in that range. There is a thing called white coat syndrome, which you may have heard of. And that is where patients are a little anxious when they come to the doctor, and that first reading when they walk in may be high because you're tense, or maybe you just had to fight traffic before you got there, or you're waiting on some test results and you're nervous, wanting to know what the results are going to be. And so that blood pressure reading may be a little high, but after you've calmed down, maybe you've received good news and you repeat the blood pressure, it should be lower. But the best way to really know if your blood pressure is always in an abnormal range is to take at least three different readings on three different visits. So if your doctor has seen you multiple times and there are three or more readings that are above the normal range, then it is diagnosed as high blood pressure. If you have a blood pressure machine at home and you can measure it at home, that's also good. I do encourage you to take that machine into your doctor's office and let them compare the reading on your machine with the office machine to see if your machine is reading accurately. Now, when is the best time to measure your blood pressure? I've been asked this question many times. In general, a person's blood pressure starts rising before they wake up in the morning. A few hours before you wake up, your blood pressure starts to rise. And the highest reading is usually around the middle of the day. And then in the afternoon, it starts to trend down. And the lowest blood pressure would be while you're asleep at night. That's a normal pattern. Now, everyone doesn't have this pattern. There are things that can affect the pattern where some people's blood pressure is remaining high while they're asleep or other things like that. And this can be due to different reasons. One would be having underlying illnesses like a thyroid problem or sleep apnea or having kidney problems or just even different lifestyles. Like if you're used to working a night shift, your blood pressure may be higher at night than it should be. Um, if you are a smoker, your blood pressure can remain unusually high because of the smoking factor. Um, Being overweight, being stressed and anxious, or you have been prescribed blood pressure medications and you're not taking them, so your pattern continues to be irregular, or you have sleep apnea and that's not being treated. These are other things that can affect your blood pressure. But considering that you may have a normal pattern, where it starts rising before you wake up in the morning, gets to a high around lunchtime, and then lowers itself down in the afternoon. So, the best time really to check your blood pressure would be at least twice a day. I recommend for my patients who already know that they have high blood pressure and that they are on medications to take the blood pressure about 30 minutes to an hour after you have taken your blood pressure medications. You should also take it when you're relaxed. Don't try to come in the house after you've just gone grocery shopping and fought the traffic, and then you plop down on the couch and say, okay, let me check my blood pressure. And then, of course, it's going to be too high. And then you're going to get more anxious about it. And then you're going to repeat it again, and it's going to be even higher because you are anxious. So you want to relax, give yourself some time to relax. And you want to sit in a comfortable chair with your feet on the floor. Do not cross your legs. And then you want to raise your arm up to the level of your heart and rest it against something like a table or a pillow, and then measure the blood pressure that way. You should alternate, which arms you use to measure your blood pressure. So one day you may do it on the left, another time you may do it on the right. If you have time and you're concerned about your blood pressure, you can do it twice a day. If you are trying to determine whether or not you have high blood pressure or not, I would suggest doing it twice a day. If you already know you have high blood pressure and you're on medications and you just want to see that your medications are working well, and if it is, then once a day should be fine, once a week. It all depends on what you and your doctor have discussed. A very frequent question that I get is, can I lower my blood pressure without taking medications? Before I even answer that question, I want you to also think in the terms of prevention and cure. So there are several sources online and you may have heard of many recommendations for things that you can do to lower your blood pressure, whether it be something herbal or lifestyle and diet and exercise. I would always want to assess your own personal situation. Some people are in a place of prevention, meaning they don't have high blood pressure, but they want to do things to prevent it from becoming a problem. Or they have slightly high blood pressure and they want to do things to lower their blood pressure. And even though lifestyle and diet affects everyone, you're going to notice more of a benefit if your blood pressure is somewhat manageable already. And in that case, then yes, then you may be able to manage it without medications. However, if you assess yourself properly and listen to what your doctor's assessment is, and your blood pressure tends to run really high, I'm talking like 210 over 100 or 180 over, you know, 95. Those are really high numbers. And even though lifestyle changes will bring the blood pressure down, you have to think that maybe lifestyle may bring the number down by 5 or 10 degrees. So you may go from 185 to 175 or 175 to 165. But there may be additional help that is needed with medications. So I'm not pushing medications on anyone, but I'm also wanting you to consider what your status is and see whether or not you are a candidate for just lifestyle changes, or if in addition to lifestyle changes, you need medication to help get that blood pressure under control. So, some of the lifestyle changes we actually hit on last month when we talked about heart health, but I'm going to review some of those now quickly. If you are overweight, then of course losing weight can make a tremendous difference in your blood pressure. Sometimes just losing 10 pounds will bring your blood pressure down by several notches. A low sodium diet is usually recommended. And for some reason, again, we are fearfully and wonderfully made. It seems that Blacks are more sensitive to salt than other races. So you cannot look and see what other people are doing and decide that I can do the same thing too. We're not quite made up that way genetically for the most part. Salt does a number to us, as well as pork. And so, those are some things that if you are at risk for high blood pressure or you already have high blood pressure, you want to either eliminate or modify. Now, you may ask, how much salt is too much? Based on what's recommended for the amount of sodium for the day, which is what salt is, when you're reading your labels on your packages, you look for the word sodium. The maximum for the day in someone who does not have high blood pressure is 1 teaspoon of salt per day. That's 2,300 milligrams. If you do have high blood pressure, or if you have congestive heart failure, then it's about half that. So about half a teaspoon of salt for the day, which is 1,500 milligrams of salt. Another broadcast, we may look more into labels on packaging so you can get some idea of what I'm talking about with sodium intake. So lowering the salts for most people, if you can stay under 1,500 milligrams a day, which is less than a half a teaspoon of salt a day, that would be great. For those who are smokers, quitting smoking can make a huge difference in your blood pressure. Regular exercise also helps, as we talked about last month. And then including more fruits and vegetables and things that are high in antioxidants in your diet will also help. Things that also help are beets and garlic. So by including these things in your diet, you can make a lot of good changes to your blood pressure. If you are doing that along with guidance from your doctor and your blood pressure is in the normal range, you may not need medications, and that's wonderful. And if you are doing that, but you're not quite reaching the goal, don't get too frustrated with yourself. Just thank God for the blessings that He's given you through your genetics, But what you need to do is get some additional help with medications along with those healthy lifestyle changes. Another way to really limit your salt intake is, of course, eating out less. When you eat out, especially at fast food restaurants, there's a lot of salt already in the food. And then if you take the salt shaker and add on top of that, you're really taking in a lot of salt. I have heard this so many times where patients says, "Oh, I don't eat salt. I don't use it at all. I don't add any salt to my food." But then when you delve into it some more, they are eating foods that are high in salt. So sandwich meats, chips, nuts that are salted, saltine crackers, things like that are high in sodium, and you do want to pay attention to the labels. I've also been asked, is there a difference between sea salt and regular table salt? When it comes to the amount of sodium that's in them, it's pretty much the same. You know, the sea salt, as we know, is evaporated seawater, and so it may have more minerals in it than table salt does. But as far as what it does to your blood pressure, it's pretty much the same thing. So cut back on the salt, okay? This last part I do want to touch on is actually blood pressure medications. If we are at a position where the lifestyle changes are not sufficient to get the blood pressure down below 139 over 89, then your doctor may prescribe something for your blood pressure. There are different classes of blood pressure medications. And so there are diuretics, which are what you'd call a water pill. They may cause a little bit of increased frequency of urination at first, but then over time that should kind of calm down. Uh, that gets rid of excess sodium in your blood and excess water, which is what raises the blood pressure in the arteries. So that's the value of diuretics. Then you have calcium channel blockers, and an example of that is amlodipine or Norvasc, if you've heard of that. That helps to relax the arteries and open it up more so that the pressure of the blood flowing through the arteries is lower. Beta blockers, these are things like metoprolol or carvedilol, which can also be used for heart problems as well as blood pressure. Or if you have an abnormal heart rhythm, those beta blockers help with heart rhythm, heart failure, and they also help with blood pressure. ACE inhibitors, such as lisinopril, ARBs, such as losartan, they reduce the workload of the heart and help the blood vessels relax. So there are different categories. And so your doctor initially will start you on one of those medications. Is there one that, I've heard people say, you should never put blacks on this particular medication. I'm not going to call a name. And that's because of, some rare side effects that have occurred, but I mean, not completely out of the question. They have occurred, but it does not mean that all blacks cannot take that medication. It just means that there are some that have had the side effect of lip swelling with a certain drug, which I won't name. But it does not mean that all blacks cannot take it. Again, we are fearfully and wonderfully made, meaning we are unique. And so you cannot always take your neighbor's experience to determine what's going to happen with you. So there are times where your doctor will start you on a particular class of medications, and it may bring the blood pressure down to the range that is needed, but it may not be sufficient. As I said, each change that you do and each medication that you do may lower your blood pressure by 5 points or as much as 10 points. But sometimes you need even further reduction in your blood pressure. And so they may use another class of medications. So now you're on two blood pressure medicines instead of one. And there are people that, for whatever reason, sometimes they have kidney disease or they have excess weight on them or they're smoking or just family genetics that they require 3 4 as much as 5 blood pressure medicines to get the blood pressure under control because the pressure is so high. So, again, the goal is to try to do the lifestyle changes that you can, and maybe you can come off of some of those medications or come off of all of them altogether. But if you're going to do that, make sure that you're under the supervision of your doctor and you can have them give you advice as to how to get your number of medications reduced. So today, that's my topic. I hope that you had some benefit from what you heard today, and that if you have further questions, again, I welcome them on high blood pressure or any other medical topic that you would like for me to discuss. And thank you again for joining us today. Until next time, continue to live well. God bless you.
Before the worlds began, you were always there. You are Alpha and Omega, beginning and the end.
You have been listening to the Living Well broadcast with Dr. Levonne-Samon. I hope that you heard something today that you found helpful and that will help you get better and live better. If you have questions about your health, your medications, or treatment plan, please send them to livingwellmd123@gmail.com. That's livingwellmd123@gmail.com. I will do my best to address them at a future broadcast. You can find me here on Awesome Radio on the first Saturday of each month at 12 noon. I look forward to speaking with you again at that time, and until then, live well and God bless.